Sarah. That's a pretty name.
Thank you. And Akia?
Yes.
Akia.
Uh-huh.
Akia, D, and Shelby.
This should be nice.
I was really, really excited. I wanted to be a part of something that was specific to what I'm passionate about. I mean, Black women.
Yeah.
You don't see a lot of women in these campaigns as it relates to HIV. So yeah, put our faces out there.
I think I probably heard about it either from my mom or from health class in 8th grade. I was just so blessed to go to a middle school that had comprehensive sexual education, that didn't hide anything from us, and that we were able to understand where these diseases came from. So we had a clinic, like literally right in our high school. And like people could make appointments like for free. And you could people would get like permission slips to go out and go to their appointment. Like people would go and then come back with a bag of condoms. Like it was never nothing secretive. Like everybody knew about it. So I was just blessed that my mom was there to she didn't hide anything from me.
So I first learned about HIV. I was 16. I'll never forget. I learned about it and I was like, oh my God, why is nobody talking about this? So I think the emphasis in the Black community is pregnancy.
I would totally agree with that. I heard that more growing up than anything else about, STIs or HIV. It was, don't get pregnant, or this is how this can happen.
Always don't get pregnant. Everybody wants to have sex, but no one wants to talk about it. Mm-hmm. And I think that just goes back to how we were raised. A lot of us were raised to not talk about sex. The Black community, it just seems like everything is so taboo.
I remember in 8th grade having our phys ed teacher also teach us about sex ed. And she just brushed over, like HIV and STIs, but more of an emphasis on STIs instead of HIV. So, yeah.
Well, I first heard about it when I found out that I was living with it 23 years ago. I knew nothing about it before I found out that I was living with it. So I was pretty petrified when I found out that I was living with HIV. And that was in 1997. The only reason I found out was because I went to the doctor to get a cancer screening because my twin sister said that she had cancer.
Thank you for sharing your personal story, because we need your experience so bad as well. Because people do still think that living with HIV is a death sentence. And again, it's not. So we need each other, and that's why we're here. So thank you.
It's nice when you have people who are not living with HIV, who constantly fight in the community and talk about HIV, because you don't have that a lot. Mm-hmm. So, thank you. Thank you for doing that, because people need to see it with people who are not living with HIV as well. So thank you.
And you are living proof. We would not know your status unless you were so gracious to share it with us. And that's what our community needs to see.
One thing that I would love to see us talk about in more campaigns and just in general is how to navigate the dating world in today's society. If I were to meet someone who's HIV positive and I thought he was a really good dude and I didn't know much about HIV, he told me he was positive, how would I navigate that? I would want for people to understand that. How to date people living with HIV, how to stay negative.
Yeah, that's dating's hard.
Yeah, dating's already hard.
Dating's hard for me.
So now we're gonna ask you about your status.
Yeah.
So it is hard.
I try as much as possible in my own personal experiences and my sexual partners to really, bring it up, because I know it's probably not going to be brought up unless I do it, unless I, take that initiative to, ask about, how they feel about screening or when was their last screening. I'm always that friend who is, very comfortable and normalized and talking about, sex and, HIV and STIs, and I'm that girl, I'm that friend, so.
Me too.
In a practical sense, allowing people to understand that when we talk about HIV to people that are new partners or to our friends, we are trying to have a conversation and not a confrontation. I'm not confronting you about HIV. I'm not confronting you about your sexual health. I am trying to talk to you because now it's important to me. And if we're having sex, it's important to us. Hopefully. Really am enjoying the fact that so many of my Black female counterparts are so open, but I still run into a lot of issues with my Black men. I hope we get to that a little later.
With me being an advocate and working to talk with the Black community and Black men, I can give you a few examples where I went inside a Black barbershop and walked around and gave everyone my card and told them what I was in there for and if it was okay. And they said yes, but no one would speak to me. Not one man, not one. You know, again, it's that fear. I still call it that taboo.
Working with Black women in the field, I've seen us be very, very assertive in a lot of areas of our life. But when it comes to sexual health, we're really, really passive. Have you all seen the same thing?
Definitely.
I've seen the same thing.
And I think for us Black women, you know, you do want to have sex, you do want to have that intimacy. I mean, he's talking about he don't want to use a condom, you know, things like that. So that plays a really big part. We need to empower each other and other women.
I know that's right.
And take some of the power back from men because they're making a lot of decisions that affect us.
And I always say, if they don't want to wear a condom, then they're not worried about your sexual health, so that's not the person for you. Period. Period. The church and the Black community, I mean, church is our home, you know? People in the church listen to our pastors. We listen to our ministers. We listen to the faith leaders. So if they would just have these conversations, it would help in all areas. I think it's because, just like you were mentioning, that it's the Bible. Not supposed to have sex before marriage.
Yeah.
I actually grew up in the Black church. So in my experience, I am seeing a shift in faith-based organizations or, you know, ministries becoming more open to discussing HIV and sexual health and prevention. However, there is still a big barrier.
I was actually called upon to do a talk with my local church, but I was a little disheartened because I wasn't allowed to talk to the youth and I wasn't allowed to talk to the women. I was only allowed to talk to men, as if men are the gatekeepers of sexual health.
The conversation about sexual health is conflicting with, you know, what our faith or religion says, but that's actually contradicting and everything that, you know, everybody's doing, because everybody's doing it. We're just not talking about it. That's something that I would like to see change. More faith leaders become, you know, more culturally competent and allowing some of their ministries to, you know, sort of use faith and prevention education hand in hand.
So what the church can do is when we're talking about HIV prevention and sexual health, give it to the masses. You could talk about it in the sanctuary, but let's talk about what can we do in today's society to really be helpful to our community.
You know, just as a people and some of the things that we've gone through systemically with racism and our relationships with the healthcare systems, we just have a lot of mistrust for the medical care system. And so we just don't really know how to just start the conversation. So
also too, when we have this issue of when we do go to the doctor as Black women and we feel like we're not being heard, that creates mistrust. If I go in and say I have chest pain and you say go take some Tylenol, I say, well, this chest pain has been here for 3 months. Tylenol ain't been working since then. That creates medical mistrust. Not to mention the Tuskegee experiment.
My personal experience, mistrust with the medical community, I've always heard my grandparents talk negatively about doctors and nurses, and so you think about how that's compounded when it comes to going to get screened for HIV or STIs, right? But I think, and what I found is that when we see healthcare providers that look like us, then we can sort of pass that along and try to, erase some of those anxieties and fears that have been planted in us from generations way back when.
One thing that also will help with the religious aspect and in rural areas is tackling the aspect of confidentiality. Because I can see when people go to church and they go like, "Oh, honey, she knows about this person, this person." That's a real fear in the Black community about people knowing your business. So when we say what can be done to help with HIV prevention, maybe tackling stigma, because if I do bring a mobile unit to the rural areas, but you don't trust me enough with your confidentiality, or if you say, well, somebody's gonna see me at this testing van, so I don't feel comfortable, because we can maybe bring the access to them, but then also tackling that stigma.
Totally agree. Our community has just not really been welcoming in terms of having normalized conversations about HIV and what it is, because truth be told, when you start becoming sexually active, you need to be in the know about HIV, and that just hasn't been the thing for our community.
Do you feel that because years ago, like in the 80s, HIV was more, people say, a gay, virus, a gay disease, a gay infection, so they're afraid to get tested, because if they do find out that they're living with HIV, then people are going to think that they are gay.
Some men may feel that, but from the men around me and a lot of my clients, it's more so of, I don't have any symptoms. Even if they're having sex with multiple people, sometimes they go, well, I'm not having sex with that many girls. So it's just a lot of lack of perceived risk, lack of knowledge. If we can kind of put it back in a forefront of HIV, the H in HIV is human, and that affects all, and we can all be in this together.
One sure way, because there's not a cookie cutter way to do this either, to dispel stigma in our community around mental health and HIV prevention, is taking the each one, reach one approach.
If you have HIV, getting and keeping an undetectable viral load prevents transmission of HIV through sex. This is sometimes called being undetectable. Treatment equals prevention, or undetectable equals untransmittable.
When it comes to HIV prevention methods, you have to give people a toolbox, because one size is not going to fit all.
I love that and totally agree with it. But I'm personally a foodie, so I like to call HIV prevention today a buffet. This type of food or this meal wouldn't necessarily work for the next person as it does for me. So we have to take that into consideration.
I have a friend who is, I don't know what it's called. I think it's called PrEP. I'm not sure, but the drug to prevent you from getting HIV if you're sleeping with people. And he's gay. And I've never heard of some like a straight woman or male taking PrEP.
That is so powerful, Shelby. I feel like that just goes back and speaking to some of the solutions that we need to see in the field. Wherever we have an opportunity to share our knowledge, share our experiences, because just like Shelby said, she hasn't heard about straight women taking, HIV prevention meds. As providers, we know that that is not true. And so that's the type of messaging that we have to work to get over. There's so many ways to reduce our harm now when it comes to HIV prevention that we didn't have 20 and 30 years ago.
Can still talk about condoms. We can still talk about monogamy. There's treatments as prevention. I always tell people to get people tested in the beginning. Get a test because that's like a baseline. So if something were to ever happen in the future, you're not saying, man, I got tested in 2002 and I don't know when I got this. You can say, hey, I got tested once a year, which is last year. So something might have happened during that time frame. I've heard of You Equals You and being undetectable, but again, I'm in the field. I don't think I would have ever heard about it without working in the field. And then the only time I've really heard about it, well, other people talk about it, is gay men. And so when we talk about Black women, we talk about other groups. I don't think we've gotten the message so much as other groups like the LGBT community. And so that's something that we also should talk about.
You Equals You is, it's part of my life. And it's part of my life because I know that it's saving people that are living with HIV. It's helping people living with HIV know that they can't transmit. It's giving a lot of people living with HIV more smile, more hope, because when you don't feel like you're infectious, it makes a big difference in your life.
I hear that from my mom 24/7. That's all I hear. Undetectable equals untransmittable. That's it. That's all.
I can now say that I know people who have lived to be in their 50s, 60s, and 70s with HIV, and nobody ever thought that would happen.
It's the individuals in the community that have to go back and take the information and the messaging and share You Equals You in their particular community.
It was important for me to be a part of because I know how important it is for my mom and like talking about HIV.
Thank you, baby.
I was born on the Kwanzaa Principle Day NIA, so I know that HIV prevention has now become a part of my life's purpose, and so I could not miss this opportunity to participate in this campaign and share with my people and my sisters and my brothers the conversation on how to continue and to start normalizing sexual health, because it can lead to normalizing so much more.
That part.
Just being in the HIV field, I had some stake in it, but now I got like big stake because Black women all day, you know?
Big stake, yes! I like how you put that. I love this campaign.